I think that one of the big challenges in open health research is really that we need people to participate in research. And I think there is a major issue in that most people don't participate in organized health research. And it's something that I call the participation paradox. Because if you ask people what they care about, health and healthcare are usually near the top of the list. And the professions that people trust the most include medical scientists and healthcare professionals. As you might expect, lawyers and marketers are near the bottom, but people who are in health fields or health research are near the top. So the paradox is that people value health. Health professionals, whether or not it's healthcare workers or researchers, are trusted more than other groups, yet people don't participate in organized health research. And so I think a major challenge that we need to overcome in open health research is addressing this issue. But it's also a major opportunity. The opportunity is that I think we really need to change people's mental models of what health research is all about. And that often people think of health research as an avenue of last resort. It is a way that if you are very sick with cancer or are dying of cancer and the first treatment doesn't work, that health research is about joining clinical trials in order to get access to experimental therapies. That is, of course, a very important aspect of health research, but it's a very small component of a much larger enterprise. And so we have to help people recognize that health research is not just an avenue of last resort. It's also the first step toward solving individual health problems, family health problems, community health problems, public health problems. And so taking this challenge and this opportunity together, one of the ways that we can do this is through open science methods that are really more able, I think, to demonstrate in a really meaningful and reproducible way the impact of individual participation in health research that leads to new insights that are reproducible by other scientists and then more likely to be effective when they're applied in a healthcare setting, whether or not that's taking care of your family in your home or getting a treatment in a hospital. And so I think that we're really at a turning point in health research, being something that is a fringe activity that is practiced by only a few members of society into something that becomes a widely practiced cultural institution that people recognize it as something that will be able to improve the lives of their loved ones and those in their communities. Another major challenge in our society today, particularly with the incredible advances that we see happening with technologies all around us, in that big things become small, expensive things become cheap, slow things become fast, and this seems to happen at such a rate and almost as if it is inevitable. And that in some way, I'm afraid that this is something that is creating a sense of passivity in that, oh, the medicines that will be required or the treatments or the preventative strategies that are important for me or my family to avoid some illness or catastrophic disease, that those will just automatically be created by somebody because there's all this progress happening, when I don't think we've done a really good job as researchers, as communicating the essential role that people play in plugging into organized health research, and that if you really want to realize progress in addressing the future health needs of you, your family, your ancestors, that it's really important to actually get involved in health research, and that by participating, and that's really the only way that this progress is going to happen, or likely to happen in ways that will beneficially impact you or your family or your ancestors.